Hi doctors, the topic for today is, can you do a ligament assessment, or can you determine the severity and location of ligament injury without an excessive motion test? And the answer is 100% no. So the majority of the doctors in the market today that are treating spinal injuries are missing serious spinal ligament injuries. It happens every single day. Now it's happening because the doctors don't know how to do a spinal ligament injury assessment. They don't know what a ligament injury leaves behind that you can image. Now, when we image something in imaging, we're looking for imaging biomarkers. So a fracture in an image is a imaging biomarker. A herniation on an MRI is an imaging biomarker. Excessive motion is the most serious imaging biomarker for ligament damage. Now, most doctors today, and most attorneys, quite frankly, and even insurers, do not understand this simple concept. Now, the nice thing about it is that any doctor that does can dominate their market. It's like you're a doctor that for the first time is coming in and you know what an MRI can do for a disc herniation, and nobody else knows how to actually do a disc herniation workup. They don't even know how to send to an MRI. Now, if you were the first in the market to know that, you could dominate your local niche, your local market, into a niche. The majority of doctors in the market today do not know how to do a simple ligament injury assessment. They don't know how to determine the severity and location of a ligament injury. If you walk up to them and say today, hey, how do you determine the severity and location of a ligament injury, which happens to be the #1 cause of pain and disability in the market today? #1. There's no more expensive injury in the market today than a spinal ligament injury. Employers are getting crushed by it. Insurers are getting crushed by it. The public is getting crushed by it. Anyone that you know that suffers from chronic pain, more than likely, I'd say 90% of the time, regardless of what joint it is, if it's in the spine, if it's in the shoulder, if it's in the wrist, if it's in the elbow, if it's in the knee, if it's in the ankle, it's in the foot, it's in the toe, it's in the fingers, they're suffering from a ligament condition. The #1 cause of pain and disability are spinal ligament conditions. And yet the majority of doctors, medical doctors, chiropractic doctors, doctors of osteopathy, physiatrists, don't know how to determine the severity and location of a simple ligament injury. Now that's bad for the market, but it's good for you. It's good for you if you know how to. It's been incredible for me. You're listening to me right now because I'm a doctor who's figured that out. Not because I'm the smartest doctor in the market, it's just I figured it out. And others have figured it out as well. But without excessive motion testing, you can't determine the severity and location of a ligament injury. Look, when the spine injures, it has to derange. Any body injuries are derangements. If a dog bites you, it deranges tissue. Now, if it bites me in the wrist and it just takes a little scratch, it basically is a minor dog bite. All right? If it bites me to the point where it gets tendons involved and it snaps a tendon, it's a more serious dog bite, right? So depending on what gets deranged and how bad, if it bit me in the jugular and it deranged my jugular, I could die from the same dog bite that in the wrist doesn't hardly cause me any problems, right? So all injuries are determined by derangement of body parts. The spine is no different. The spine deranges imaging-wise in a way that you can see it in 3 ways. You can either fracture it, cause a disc herniation, or cause excessive motion. Excessive motion is by far the worst condition because excessive motion causes the spinal instability that causes chronic pain. Today we are so over-reliant on MRI. Lay down MRI. Good. So when a person has a disc condition, because that's what an MRI is looking for, if they have a disc condition, what do they want to do? They want to lay down on their back. Why? It takes the least amount of pressure off the disc, right? Retracts the disc off of the nerve in that position, but that's where we MRI. That's where we positionally look for disc herniations, in that position on an MRI, in the least problematic position there is. Now, that being said, even if we pick up disc herniations on MRI, there's 9 other ligaments around a disc. You got to know, is there excessive motion at the level, below the level, above the level of this disc herniation? Because without that information, you don't know the severity and location of, you're not getting the full picture. There is not a doctor in the country without excessive motion testing that can determine the severity and location of a ligament injury. So if you're a doctor and you're not using an excessive motion test, and I have recommended in my Smart Injury Doctors program till I'm blue in the face that it needs to be done independent. It needs to be independent of the provider because the findings are so significant that it should be done independent because it's going to drive all of your care. So if I'm an insurer or if I'm a defense attorney and you're doing this test yourself, I know that you have a vested interest, and that vested interest can be manipulated to make the results look worse than what they are. And nobody's checking your work. That's why you want to have it be unbiased or independent. That's why, as a CEO of, I think, the best medical excessive motion testing company in the country called Spinal Kinetics, that's why we exist. We're independent. It's an independent company, and we're unbiased. We don't care what the results are. We don't have any dog in the race, so to speak, other than to do it accurately. So you want to do it independent and unbiased, but you cannot determine the severity and location of a ligament injury without it. And anybody that wants to stand up and debate that you can, it's a really simple debate. Now, just as simple of a debate as this is, that actually communicates in depositions, it communicates in trial. It is the most incredible stuff that I have ever ran across. That's why I get so excited about it. That's why I created the Smart Injury Doctors program. And so, doctors, if you're out there right now and you are not testing, in my experience, especially on injuries, on all injuries, in injury care in the country, I personally feel at this point that malpractice is being committed. Right? Why should a patient go to a doctor that doesn't know how to determine how severely injured they are and get paid a lot of money to try to correct what the patient is going through? If you understand how to test and you're not testing, to me that's malpractice. It's malicious malpractice. So what you want to do is you want to test, and you want to be proud of the fact that you are testing because you understand it, and you're not going to be knocked out of there because the confused market doesn't understand it. And the confused market has been over-reliant on MRI. MRI is great for disc, but it's not designed to pick up excessive motion problems. And those are the most problematic injuries in the market. Doctors, every time I do a podcast, every time I do any kind of a podcast like this, I'm just jumping on a topic, explaining it for a short amount of time. I do appreciate any comments, concerns, anything else that you want to put down below is fantastic. I ask for it. The last thing I want to say is I really appreciate your time. I appreciate your attention to this problem. I appreciate you listening to me, and I hope to see you on the next podcast. Thank you.